The radial nerve.
Anatomy and palpation.
The radial nerve can be palpated along its length. It's a long nerve and vulnerable in the upper and lower arms. At the humerus, the nerve can be palpated and flicked upon. And then the radial sensory nerve on the lateral, slightly volar aspect of the forearm can be palpated, and the nerve here may be involved, for example, in de Quervain's tenosynovitis. Notice here I've tightened the nerve up a little more by performing a Finkelstein test. Active quick test. Here I've asked Dave just to internally rotate his arm, hold his thumb in, and then depress the shoulder girdle. And this allows a quick test of the radial nerve. Therapist assessment. The ULNT2 for the radial nerve. Here Dave is lying to one side of the bed, his shoulder girdle over the side of the bed. Step 1. Using my thigh. Shoulder girdle depression. Elbow extension. Whole arm internal rotation. Check for symptoms at each component. Then wrist flexion. Any symptoms evoked can be structurally differentiated by elevating the shoulder girdle. If required, a little more abduction can be added. Therapist assessment. The ULNT2 for the radial nerve seated. Here I have Dave's arm cradled, shoulder depression, elbow extension, now the internal rotation. Any symptoms can be structurally differentiated, and that is also a nice mobilization. Therapist assessment. ULNT2 radial from the wrist first. Notice Claire is holding her thumb, ulnar deviating her hand, extending the elbow, and now depression. This would be an appropriate technique, using order of movement principles, for a radial nerve-based problem at the wrist. Symptoms that are worse on depression should make you suspicious of a neurogenic component. Passive techniques. Gentle radial sliding. Here I have Dave's arm cradled. I'm asking him to point at his nose, at the same time gently depressing his shoulder. It's a slider technique, and it's a way of performing the technique in some distraction. Passive techniques. Whole arm rotations. Again, in the seated position, I have Dave's arm and I'm performing a total arm rotation, encouraging him to help me do the movement, and that may be appropriate at some of the later stages of radial nerve involvement in humeral fractures. Passive techniques. Radial head mobilizations in ULNT2 for the radial. Here I've taken up the radial nerve position, and in this position I'm mobilizing the head of the radius. It's quite an aggressive technique. In the same position, soft tissue techniques can also be used. Self-management, gentler movements, pouring water. The act of pouring water, even if there's no water in the cup, or even thinking of pouring water, is a gentle way to begin to mobilize the radial nerve. And it's very functional as well. Gentler movements, figures of 8. I've asked Dave here to try and swing his arm in big figure of 8 movements. The radial nerve will be mobilized gently. Self-management, gentler movements, pump water. Here you can use the good arm to help mobilize the sore arm. Notice the internal rotation, and one arm is being used to help the other arm mobilize. Self-management, gentler movements. Look at your hand behind your elbow. This is a fun way to mobilize the radial nerve. Ask the patient to look at the hand behind the elbow. See if they can see their fingers. See if they can see all their fingers or even the thumb. This can be done bilaterally as well. Self-management, stronger movements, back massage. This is functional. I've asked Dave here to try and massage his back using his wrist, to try and reach to the farther side of his back, or I could even get him to imagine that he's drawing a number on his back. In this position, the radial nerve will be reasonably aggressively mobilized. Self-management, stronger movements. Tip, please. The waiter's tip is also a fun way to mobilize the radial nerve. Self-management, stronger movements, a table stretch. Note here, I've got Dave to put the back of his hand on the table and then to try and rotate it. In that position there, as he's internally rotating, the radial nerve will be quite strongly mobilized.